HYLO Night improves the tear film and protects the surface of the eye. When applying eye ointments, the tube should not come into contact with the eye or skin. Only use HYLO Night if the seal of the outer pack remains intact before the first use. To start, remove the protective cap. Tilt your head backwards and gently pull down on the lower eyelid using a finger of one hand. With the other hand, hold the tube in an upright position above the eye. Without touching the tip of the tube to your eye or eyelid, instill one strip of eye ointment into the gap formed between the eye and the eyelid by gently squeezing on the tube. Close your eye gently, then blink normally. The thicker consistency of the eye ointment causes a slight impairment of vision. Once finished, replace the cap firmly back onto the tube. Remember to avoid contamination. Do not allow the tip of the tube to touch the eye or any other surface. HYLO Night can be used for 6 months after first opening. To learn more, visit scopeeyecare.com or contact our customer care team at info@scopeeyecare.com.